Those diagnosed with cancer in their teens or 20s or 30s can be very different from being diagnosed with cancer in your 50s, 60s, or 70s. Adolescents and young adults are in a critical life stage for social, developmental, educational, professional, and financial growth. A cancer diagnosis and cancer treatment during this life stage can delay or forgo the attainment of milestones, including autonomy, moving away, going to college, securing financial independence, and starting or growing a family. We often see that in three main areas. There can be areas in which the needs of AYA cancer patients are under-addressed or under-assessed. Those three main areas tend to be fertility, psychosocial needs, and survivorship. The AYA Champions program is a professional development program for advanced practice providers to increase their knowledge of AYA needs. The program could also be extended to nurses as well. It's a program that educates these APPs or nurses on the needs of AYAs and gaps in care that can occur with AYA patients, and they go back to their departments and educate their department and become a resource in their department for addressing AYA needs. Sure. In 2018 at MD Anderson, we decided to better address the AYA needs. There needed to be an AYA clinic. So the clinic is staffed with physicians, nurse practitioners, a dietitian, a genetic counselor, as well as vocational counselors to better address the needs of AYA patients before, during, and after cancer care. Our aim is to better address the gaps in care that can occur for patients in their teens, 20s, and 30s that are undergoing treatment at MD Anderson. We've had overall positive feedback from patients as well as nursing that's been involved in the program. The program has addressed 83% of patients say that the program has addressed needs that weren't previously addressed by their treatment team. And the APP providers feel better equipped to address the needs of AYA patients they see in their clinics and their departments. And our hope is that others are educated within those departments on addressing the needs of AYA patients. I think looking at those main areas, fertility, psychosocial needs, as well as survivorship would be a way to start. Ensuring that patients in their teens, 20s, and 30s have received fertility counseling before treatment has started and have been referred to fertility specialists if they do express interest in preserving their fertility would be one means. Another way would be to make sure that you're addressing the psychosocial needs of patients, so asking questions and screening for symptoms of anxiety, depression, post-traumatic stress disorder, and then normalizing and validating those feelings if patients express that, as well as making sure that they get referrals to mental health providers or additional psychosocial supports like support groups or resources within the community that may help them through their cancer journey. One other big thing for our AYA patients is vocational counseling. So college patients that are in college at the time need to know how to kind of navigate that, to contact the Office of Disability and kind of register with them. And we have a vocational counselor that kind of works them through that process. Also, patients that are employed have questions about what their rights are in the workplace or what reasonable accommodations they can ask for. We have a vocational counselor, and there are vocational counselors in the community too that can kind of help address those needs as well. So it's not only looking at their mental health, but also kind of school and job related issues that can arise in AYA patients. I think lastly, survivorship. Survivorship for a 20 or 30-year-old is very different than a survivorship for a 50, 60, 70-year-old. 85% of AYA patients will go on to be survivors, and tailoring their survivorship care towards those needs, especially like for our women patients around pregnancy and thereafter, as well as kind of fertility after treatment as well. Those are all aspects that come up in survivorship for AYA patients that might not come up for other patients. And so a unique survivorship plan that is geared towards AYAs is definitely needed.